This machine will have eyes, ears, and a voice.
This is PVP Television News, reporting from a public meeting at the Elephant and Castle, Newtown. A public meeting is about to commence to discuss the controversial plans of moving NHS services from Shrewsbry to Telford. We'll now go over and speak to our local MP, Glyn Davis.
We've had three public meetings, one in Llanidloes last week, Gospel last night, over 200 at each, and tonight we've got a meeting here which looks as if that's going to be over 200 as well. A terrific number of people turning out, and the message is the same from all of us. We don't like the proposals that are in front of us. I mean, our belief is that when you have emergency services that serve Shropshire and Mid Wales, they should be in the middle, and in the middle is Shrewsbury.
And now we'll have a word with Mick Bates, a Welsh Assembly member.
Because what is happening here is people power. In the face of what are drastic reductions in service to the people of Montgomeryshire, there is a tremendous swell of ground feeling in Montgomeryshire against these proposals. And I'm proud to be part of that, to try and retain the quality services we have in many fields, but in particular, of course, women and children's services, i.e. maternity.
We've got candidates here as well. We've got representatives from the CHC. They've got a watching brief here tonight. They're listening to what you have to say. We've got somebody from the local health board here at the back there we may well be able to talk to later.
At the minute, we've got Shrewsbury. If there's no beds for children, they can be moved to Telford. That's far enough. If there's no beds in Telford when Shrewsbury's gone, we go to Birmingham, we go to Wrexham, Bangor. It's going further and further and further away all the time. Have you had a child in an ambulance sick? It's not pleasant.
I have to say, one of the things I've learned is that you do feel that, as you say, you feel isolated, and you feel that some of the services that you have aren't as responsive as they could be. And one of the things I take from that is, irrespective of whether this consultation leads to change or not, one of the things I am committing to do is to work with our colleagues and partners in the Powers Teaching Board and with the two ambulance services responsible to see what we can do to improve access for you.
You know, once we're into Powys, we're already a long way away from Shrewsbury, and I did a quick thing on AA Route Finder before I came, and in good traffic, it already takes 40 minutes to get from here to Shrewsbury. Now, if you've got a sick child or you've got a pregnancy that's gone unexpectedly wrong, you can add another minimum of 20 minutes to get to Telford. And if you're in Telford, you can go to Shrewsbury, you've got Telford, you've got Birmingham. You're already much more central. And that's from Newtown. Never mind once you get out further into Lanny and places like that where the roads are worse and worse and worse. You know, we're going on reasonable roads to get there. So I would like you to bear that in mind. Thank you.
All right. Let's look at the business here, Adam. And it was raised by Mick as well. That, you know, what does consultation mean? Because you've heard it said before in previous meetings. Where's Plan B?
Well, if I just go back to the three dilemmas that we've raised, those are real dilemmas which we have to find a solution to. And what we did to develop these solutions, I arrived in the Trust in July of last year. And one of the first things I did was I got a group of GPs and consultants together, and I said to them, look, these are three problems, do we agree? And everyone agreed. And I said, well, can you tell me what we can do about them? Because we need to find some solutions. Now, part of my responsibility is to say what I think the constraints are. And there are constraints. Unfortunately, there are constraints. One of the constraints is how much capital we can afford. So within those constraints, what can we develop? So these ideas came out of two workshops that those consultants and GPs worked on. I want to emphasise that nobody, I think, would want to, and least of all me, would want to say to you, this is a perfect solution. This is exactly what we'd hope for. It's not. It is what that group of individuals felt on those two workshops we could do. Now, is it a real consultation? I certainly don't want to be responsible for a set of services which it is judged are unsafe. I think that puts us all in a really difficult position.
Now, if you haven't got any transport of your own, and there's a number of my residents that haven't, and you have an appointment at 10 o'clock in Telford, you can't make it. Because the public transport out as far as Telford is appalling. You could, of course, get the 6:43 train out of Newtown. That would drop you off in Telford. Now, unless you've got wings or money to afford a taxi, you will not make it. There's no buses, as far as I know, to take you from Telford rail station out to the hospital.
As we've listened to what people have been saying to us, is we do understand that for many people who've been used to using Shrewsbury as their local hospital, travelling to Telford is a further and difficult step. So part of what we're going to put on is a shuttle service that will run free for patients and their visitors between the two sites round the clock. And people have said to me, how can you possibly afford to do that? Well, it's quite simple. We're spending more than £1 million a year on travel costs in our organisation because of the distance between the two hospital sites and because of the way in which staff move backwards and forwards.
John. Now, I know how many times St John are called on to do work for the ambulance service. And it's a tremendous number of times. I'll just give an example. On one Sunday, our team went twice to Morriston and once to Liverpool. One team. That's the deficiency of the ambulance service in this area. Now you're going to put more emphasis on the ambulance service in this area. And the other question I'd like to ask, the public here have been put into the front line tonight. They're facing you. Where are the people that we pay to face you? The members of the Teaching Health Board who spend our taxes. They should be putting up a fight. The Welsh Assembly should be putting up a fight.
I'm from Newtown, and I had twins at 26 weeks gestation in Shrewsbury, and I'm absolutely appalled at your proposals. I travel to Shrewsbury every day for 4 months.
Russell George, Conservative candidate for the Welsh Assembly. Just a word, Russell.
Yeah. Okay. The consultation is called Keeping It in the County. 200 people turned up in Llanlois, 200 in Welshpool, and 300, possibly 400 here tonight in Newtown. 700-800 people. We saw a map on the way in of Shropshire and Mid Wales. Where best to locate an emergency services, but smack in the middle? Not in Telford, on the very far east. Another reason, Wolverhampton and Birmingham, in stone's throw of Telford. Surely that's a reason for services, emergency services, to be located in Shrewsbury.
Wyn Williams, Wyn, Liberal Democrat, potential candidate for the Welsh Assembly. Couple of words.
Okay. Thank you for the invitation to speak here. As your documentation and consultation says, it's keeping it in the county. Now, we've heard one or two comments from certain people or panels tonight saying this is all political posturing here tonight. What I would say is there's cross-party agreement with these and also cross-border overall. You've only got to look at all these people here tonight, Llanidloes, Welshpool, to say the concerns that they have. It's not a political issue. This is the concern of moving Montgomeryshire patients away from timely accesses to safe services in emergency situation with children. And we've heard all the individual cases that are here tonight.
David Senior, who is Plaid Cymru candidate, perhaps for the next election. What about it then?
It was a question I didn't want to address, and I'll explain why before somebody thinks I'm avoiding it. The Conservatives and Liberals in government in Westminster, Plaid and Labour in the National Assembly, years and years and years of all of us failing to get adequate health care for Mid Wales. I don't think any of us actually have the right to be too critical of each other.
Well, what would you say to them if you got elected, David? You're Plaid Cymru.
I am Plaid Cymru. I do think that Mid Wales has been neglected for years. And I'll give you an example from my personal experience. I am a twin, and I was born in Newtown. Many years ago, that was possible. Of course, after years and years of progress in medical care, it's no longer possible. But I have twins. They had to be born in Shrewsbry. If these proposals go through, if my children have twins, they'll have to be born in Telford. And you do wonder how far that process will go and whether my descendants a long way down the line will perhaps have to be born in East Anglia.
Back there. Oh, is it you, John? Right. John Howard is Chief Officer for Montgomeryshire CHC.
I was intrigued to see that the panel and the people that were interviewed on that day did not include anybody from Mid Wales. There was no kind of body there to present the information, and I'm intrigued as to why. The perception here is, I think, that in many cases you're talking about trying to save money, but it seems to be at the expense of the people in Mid Wales. Not only for trying to find either the costs of the additional transport and things like that, but the way in which services are moving across to the east, there's a difficulty. And this is the message that I've been receiving over the last few days.
That transfer, if she was born in Llanidloes to Shrewsbury, could have been fatal in itself. But that extra, at least 20 minutes to Telford, just could have been absolutely devastating for us. That's if she was born in Llanidloes. She was born in Shrewsbury, but what happens to future mums having babies that need that transfer?
To me, it sounds like you want to save money. I'm more concerned about saving lives. I've got a daughter at the moment, and she's lovely and she's healthy and everything's perfect. My concern is, what happens if something goes wrong? I have to get to Telford. I don't get to Telford and maybe I lose her.
We, as a board, have agreed to put a further, just short of £2 million of extra money into the maternity service. That equates to 3 additional obstetricians, 15 additional midwives, 7 middle grade doctors in anaesthesia. The idea that this is about saving money is so wrong.
Before we leave the meeting, we'll now go over and have a word with Helen Jones, who has set up an online petition.
At the moment we've got 3,700 signatures on it, which I aim to produce to Parliament and the Welsh Assembly Government to get them to look into the consultation that's actually currently going on at the moment.
Let's now go over and have a word with Adam Cairns, who is the Chief Executive at the Shrewsbury and Telford NHS Trust.
Well, we've heard over the course of these last 3 nights lots and lots of feedback about our proposals. I think we've shone a light actually onto some problems that exist whether or not these proposals are implemented. In particular, I think the difficulties that people have accessing ambulance services I think is a real problem whether or not these proposals are implemented. And I've given a commitment tonight to work with the Teaching Hospital Board and others, the 2 ambulance services responsible, to see what we can do to improve the way in which that service is provided.
We've just heard the views of the Chief Executive. The consultation period ends on the 14th of March. The people of Mid Wales hope that the right decision will be made.
This machine will have eyes, ears, and a voice.